Hi, my name is Dr. Dhruv Joshi. I'm the co-founder and CEO of Cloudphysician. Hospitals today have realized the importance of having a strong critical care backbone to help the patients that need access to good quality care in life-threatening illnesses. Now, this has been reinforced in COVID because we saw the shortage of patients being able to access high quality ICU care or critical care through this pandemic. Now, this is really important for patients to be able to access good quality ICU care, because in critical illnesses, in life-threatening illnesses, patients do not have the luxury of time to either identify a good hospital or identify a good location to go to. In this scenario, ideally, patients should be able to go to their closest hospital and get access to good quality critical care to address life-threatening illnesses or critical illnesses. Unfortunately, that is not the reality today. Most hospitals across our country are not able to provide that quality care to patients who have life-threatening illnesses. As a result, patients are not empowered to access the quality critical care that they need, and hospitals are not empowered to deliver the quality critical care to the patients that come to them. Now, this is because of a variety of reasons, right? Hospitals, maybe because of the location of hospitals, maybe because of the access to specialists, maybe because of the training that the nurses have at that hospital, maybe because the appropriate processes and expertise is not available at that hospital. So it is a multitude of reasons for which hospitals are unable to provide patients the quality critical care that they need. Now, as we move forward in this scenario, we need to think of newer solutions that would address this problem. This is not a unique problem. This was a problem even when I was a doctor who was training and working in the United States. This was a problem that existed in the United States as well. The difference between the United States and India is the magnitude of the problem. For example, in the United States, there were 30 ICU beds for every 1 lakh patients. In India, we have less than 3. So can you imagine that there's a difference of scale of 10 between the problem that is faced in the US and in India. And now we know that we need to get critical care to these patients wherever they may be located. But we now need to realize that the traditional solutions that we have been using all these years have not been able to solve this problem and will not be able to solve it in the coming years. The challenges for ICUs is either they are located in places where they do not have the right specialist doctors, or they are in places where they are not able to get access to the specialist nurses, or they don't have the expertise to put in place the appropriate processes in place. These are the challenges that they have. The traditional solutions that we have rely on having access to a large number of specialists and large number of experts, and that is simply not a viable solution in the scenario today and in the years to come to address the needs that we have. So it is the need of the hour for regulators, for people in public health, and for everybody in healthcare delivery as they strategize to think of solutions that would address this problem at scale. And it is imperative to leverage technology as we think of the solutions that will address this particular need for today, for the months to come, and for the years to come. Having seen many of the new age solutions being utilized in the United States during our time there, we realized that while India needed a technology-enabled solution, it had to be a solution that was pertinent to our resource setting, that was developed for our hospitals and for our practitioners, for our doctors, our patients, our nurses. And so that is where Cloudphysician started, by building a solution that combined the expertise of highly trained doctors and nurses along with state-of-the-art technology that can be deployed at hospitals in any setting to address this particular problem. So at Cloudphysician, over the past 5 years, we have now supported hospitals by connecting them to our team of trained specialist doctors, by leveraging our proprietary technology and enabling that the patients in hospitals located far and wide can get access to high quality care. We have taken care of over 35,000 patients across 15 states in the country. We have been able to show a significant reduction in mortality in these hospitals. We have been able to show adherence to standard of care protocols across these hospitals. We have been able to show better outcomes. We have been able to show better outcomes, better workflow and experience for doctors and nurses. We have been able to upskill and train these nurses in many of these locations. And all of this together is what has enabled patients to now access good quality care in their communities, and at the same time the hospitals in these communities to provide that quality care in a cost-effective manner. So at Cloudphysician, while we have taken care of 35,000 patients already, and we have got in the COVID pandemic, we supported government hospitals in Maharashtra, in Karnataka, in Kerala, and we were recognized by the government of Maharashtra, by the government of Kerala, by the government of Karnataka for the work that we did. We realized that we are simply scratching the surface. The scale of this problem is enormous, and going forward we want to address this problem at scale, being able to provide a patient with good quality critical care no matter where they may be located. That is what we want to do. And while today we are in 15 states and about 40 hospitals, the goal is to be able to address in the next year 5 times as many patients as we have today. And again, that would also just be starting, because the scale of this problem is enormous and we want to continue to build this solution for the country and beyond.